What is autism? Recently, you've started to worry about your 2-year-old son's development. You've tried engaging him with toys, songs, and games, but nothing seems to pique his interest. He rarely makes eye contact. He prefers to play alone rather than with other children, and despite having perfectly normal hearing, he doesn't respond or pay attention when you call his name. Could it be autism? Hello, and welcome to MedTouch, the best place to find the right medical information. Autism, also known as Autism Spectrum Disorder, is a complex, lifelong neurodevelopmental disorder that impacts how children develop socially, cognitively, emotionally, and behaviorally, with boys 4 times more likely than girls to be diagnosed. The term spectrum is used to highlight the fact that no two children with autism are the same. Although they share certain difficulties and challenges, they differ in their level of impairment. Some children with autism only have mild symptoms, while others have more severe obstacles to overcome. This makes autism complex and very challenging to diagnose. Nevertheless, let's take a look at some of the signs and symptoms that may indicate a child may have autism spectrum disorder. According to the 5th version of the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, in order to meet the criteria for autism spectrum disorder, a child must experience a number of difficulties with regards to both of the following areas: social communication and social interaction challenges, and challenges related to restricted, repetitive patterns of behavior, interests, or activities. These difficulties must be present before early childhood and impair several areas of your child's life. Some examples of social communication and social interaction challenges include your child doesn't respond to or acknowledge verbal commands. For example, they don't turn their head or look at you when you call their name. They have difficulty understanding body language such as waving, pointing, or recognizing facial expressions. They also have trouble making eye contact and rarely smile when smiled at. They don't share interests, experiences, or achievements with you. For example, they don't get excited if they complete a puzzle or win a game. They don't show an interest in friends, other children, or pretend or imaginative play. And finally, they rarely use spoken language, or they are yet to speak at all by the age of 3. Examples of restricted, repetitive, and sensory behavioral interests include they have a need to follow routines or a need for things to always happen in a certain way. They enjoy playing with toys in a repetitive manner, such as lining up toys in a row or playing with spinning objects. Interestingly, they tend to repeat certain words or phrases, sometimes made-up words, over and over again, also known as echolalia. They repeat certain movements such as rocking or hand flapping as a form of self-stimulation, also known as stimming. Keep in mind, a lot of children will engage in these types of behaviours during early development. That's why a diagnosis by a health professional is extremely important. Another symptom is an obsession or fixation with certain objects. For example, rather than playing with a toy truck, a child with autism may have a fixation with spinning the truck's wheels instead. Children may also sit quietly for extended periods of time, fixated on certain objects, such as ceiling fans, or they may have an intense interest in activities such as flicking a light switch. Many children with autism are also extremely sensitive to sensory experiences, such as bright lights, sounds, or smells. They may also display consistent fussiness or problems with foods, textures, or clothing. For example, some children are unable to tolerate the feel of clothing tags or labels on their skin. Keep in mind, these are just some examples of the types of symptoms children might display. It's unlikely that your child will display all of these characteristics. Similarly, if your child is displaying only a few of these symptoms, it doesn't necessarily mean they have autism. First few years. It's important to keep in mind that during the first 2 years of life, some children may show signs of autism but eventually grow out of them. However, some children who have autism may not actually show these signs or symptoms until much later in their childhood. In some cases, the early symptoms of autism may even be misinterpreted as signs of a well behaved, quiet, and undemanding baby. Many children with autism also start to develop normally but then regress. For example, a child who was previously communicating with words may stop using language entirely, or a child may stop playing social games they used to love, such as peekaboo. As a result, most children aren't formally diagnosed with autism until they're over the age of 2. If your baby or child is demonstrating some of these possible early warning signs, it's only natural that you might feel concerned. However, getting answers sooner rather than later and gaining access to supports and services for your child, yourself, and your family is extremely important. If you're concerned about your baby or young child and want to have them assessed for autism, make an appointment with your doctor or family pediatrician. They can conduct a screening test for autism and, if necessary, refer your child to a qualified health professional. Diagnosis and treatment. If your child is diagnosed with autism, the best way to support them is by starting intensive early intervention. There are many evidence-based psychosocial interventions. Some focus on reducing repetitive behaviors and building communication skills, while others deal with food sensitivities, sensory issues, motor skills, or emotional issues. Not all treatment approaches are effective for every child, so it may take some time to find what works best for your child's specific needs. If you're concerned about your child's behavior, or if you'd like to learn more about autism spectrum disorder, speak to your doctor or reach out to a qualified health professional for more information. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.